Hey guys, Dr. Harper here, just getting ready to leave the office. But first I want to talk about acute versus chronic pain because this comes up so often. So, we know it can be difficult living with a long-term pain condition. We see this all the time. In addition to dealing with the pain itself, there can also sometimes be a frustration, a lot of times, frustration with the lack of clear and concise information regarding the actual diagnosis and treatment. So people often find though that the better they understand their specific pain, the less difficult it becomes to learn then how to work towards, either managing it or eliminating that pain altogether. So really the first questions to address here are, what are the differences between acute and chronic pain? And then again, why is it useful to know this specifically? So let's start with, what is acute pain? Acute pain is the normal pain that we feel when we experience an injury. Acute pain is therefore useful because it tells us to not put weight on a broken leg, right? Kind of useful. Or to take our hand off of a hot plate so we don't get burned. We learn these reflexes right when we're young, right? It doesn't last very long, and in general, less than 3 months. So if something's been going on with you for more than 3 months, you're in kind of a chronic pain situation. So now things are happening up in the brain, right? Chronic pain is definitely pain that lasts a long time, right? So we just talked about that, more than 3 months typically. Although it can be associated with this ongoing injury or disease process, yes, most of the pain that we clinicians treat is pain that actually continues long after healing has occurred. So it's not actually at the tissue level of, like, let's say the body parts, right? There's no obvious injury that we can relate it to, right? In many instances of this chronic pain, though, the usual clinical exams and investigations, again, they can't I'm getting tired, it's that time of night, can't adequately explain why there is ongoing pain. So it's actually pretty normal for us to find scans like MRIs and X-rays to be reported completely normal by the medical radiologist, for instance. So even though despite that you have this big pain experience happening. So sometimes pain symptoms are described as just being down to wear and tear, arthritis, or degeneration. It's kind of a poor diagnostic excuse, really, for your pain. It's not really, you don't necessarily have pain because of the result of degenerative changes. You don't necessarily have symptoms because of that. It's actually it's a normal part of the aging process to see on your images like degenerative changes, even like degenerative disc disease, for instance, as scary as that sounds. But a lot of people that have this, even to a significant degree, they don't actually have any symptoms. So you can't really rely on this structural image alone. So a lot of studies have even in fact shown that there is a very poor relationship between pain that people feel and what is identified on an image or scan. So don't let these images scare you. That's why a lot of times I don't even like to show these images to people if I think they're gonna go crazy with it, right? So over the last 50 years, they've discovered that, with pain science, which is actually that's a very elaborate neuroscience type of field, right? They discovered that chronic pain is actually related to these alterations in your nervous system itself. So signals from your muscles and joints and even your bones can literally be amplified and interpreted as pain by an oversensitive nervous system. So really kind of the best way of understanding this is, think of the analogy of a car alarm, right? So just like your car alarm should only go off when somebody tries to break in, that's the ideal situation, your pain system is like that. So your pain system should only be activated when there's an injury or disease, right? It's like a check engine light, it alerts you, right? However, we probably all lived on a street, right, where an alarm goes off with the change of the wind or a loud motorcycle rides by. Guilty. I do that a lot. Sorry, I have a loud exhaust. But similarly, we believe that as a result of a sudden incident or slowly over time, our nervous system actually can become hypersensitive to normal or mildly painful stimuli. So it's kind of like an amplifier that's been turned all the way up to 10. How do we get that dial to turn back down so it's not a 10, right? This is something that we see with brain injuries a lot, even conditions like post-COVID, neurodevelopmental conditions a lot of times, like sensitive kids. First, everyone's pain dial is a little bit different, so it's not a one-size-fits-all situation. Some people have a much harder time turning down this dial on their nervous system. We do know that many things contribute to being hypersensitive, And there are many tools now that we now have which can actually help you manage your pain and reduce its intensity or even eliminate it, even if it's been chronic for years. So this can include simple things that you can do at home, right? Gentle movements, don't stop moving, right? Integrating abnormal primitive brain reflexes, right? Doing specific brain body exercises for those things to help the brain integrate better. Managing your overall mental and physical health is just super helpful in general. Obviously like learning relaxation techniques. We often like to teach, just very specific breathing techniques, like breathing in a little bit for 4 seconds, slowly exhale for 8. Take it a step further, we got a hypnotherapist that's actually right next door. Sometimes we'll send people for that. Nutritional and nutraceutical interventions to support the gut to brain connections. It can actually be very helpful for some people, especially if they have ongoing inflammation. Specific brain exercises, things like photobiomodulation or brain body laser techniques that we use can actually be very, very helpful and very quick. But it's really, really important for you to first understand what's behind your pain and actually having a clear plan to deal with it and not allowing pain to dictate what your life is about is probably the most important thing to understand, right? Again, everyone has unique needs and we understand that. And typically everyone requires a different approach, some really comprehensive, sometimes it's something simple. If you'd like more information on this or you're kind of not completely clear on what I'm talking about and you want to get more clear, just give us a call. I'd be happy to set up a 15-minute complimentary phone consult with you. I got our numbers. We'll show you the number here somewhere on the screen, and then also our Instagram. It's just at Dr. Josh Harper. We have some videos there that we put up. We're on TikTok now too. But in general, I just want to be able to reach out to you guys and let you know that like you're not alone. A lot of people go through this issue, whether it's pain, whether it's brain injury problems, dizziness, vertigo. And a lot of these things have literally a lot of the same kind of solution once you understand this stuff. So once you understand what's happening, you can then take more specific action. So hopefully this was helpful for you guys. Let me know in comments, shoot us an email, info@calispine.com. Let us know what you think and what else you want to hear about. So I'm here to educate and help you learn because again, the more you know, the better you're going to feel. Okay. All right, guys, have a great night.